Hello, welcome to the lecture series on the pharmacology. And in this lecture, I will talk about the principles of the pharmacodynamics. In the first video, I talked about the pharmacokinetics. We have two terms in pharmacology, the pharmacodynamics and the pharmacokinetics. In the pharmacokinetics, we study that how the body is acting on the drugs. Look at this diagram. You see that when the drug administered, then in pharmacokinetics, we see how the drug is being acted by our body, like when it is administered, how it is absorbed, and how it is distributed in our body. If there is some problem in the GI, the distribution will be affected, or in some other problems, the absorption or the administration is disturbed as well. Like when the patient is unable to take orally, then we cannot administer that drug orally, and these things we study in the pharmacokinetics. I will not talk about pharmacokinetics in this lecture. All about the pharmacodynamics you will see in this lecture. And in the pharmacodynamics, we study that how the drug is affecting our body, and means the we study the actions of drugs in our own body. Look at this box. We see that when the drug is distributed equally in our body, it affects the regulatory proteins. What are the regulatory proteins? Actually, the receptors, the enzymes, or the ion channels, the transporters, the alpha or beta receptors. In enzyme example, you take the cholinesterase or acetylcholinesterase enzymes, and the ion channel like the sodium, the chloride channels, and the transporters like the chylomicrons. These are the transporters. We study these as the regulatory proteins. And in the pharmacodynamics, we study the affinity, like how the drugs are bind to the molecular target, like what is the affinity of each drug. These are important because we actually categorize the drugs based on the affinity and the efficacy. In the efficacy, we see the response of drug. And actually, in the pharmacodynamics, we study how the drug is bind to the receptor. When there is a drug, it bind to the receptor, and we see that the drug and receptor makes a complex that acts on the molecules. In another method, actually, drug and receptor binds and make a complex, and they form effector molecules. In first example, we see that there is a drug receptor complex. It directly affect the body or the physiological activities of our body. But in the second example, we see the drug receptor complex is formed first, then it acts as the effector molecule, and then it affect our body, like it can change the physiological activities of our body. And in the third example, we see the drug and receptor first forms and make complex, and these actually activate the coupled molecules, like G proteins are activated in this type, and they then affect our body, like they can then change the receptors or the ion channels or the transporters or the enzymes when the G proteins are activated. Actually, some drugs actually they decrease the metabolism of the endogenous products, and the effector molecule activation are increased. And in this slide, I will talk that how the drug and receptors interactions occurs. Actually, when the drug and receptors actually interact with each other, there the conformational changes at a structure level. That means the proteins are changes, and they make the changes in the structures, and then they act according to that. And what are the agonists? Actually, the agonists increase the activity of the regulatory proteins, like the ion channels are opened, the enzymes activity may be increased when we use a drug as a agonist. And in the antagonists, we use that the drug is actually opposing the regulatory protein's actions, means the ion channels are closed or the enzyme activity may be decreased. When we see the example, we go to the atropine for acetylcholine receptors. And actually, when we are increasing the agonists, we can overcome the antagonist effect. We have different types of bindings in drugs, like how the drug is bind to the receptors or to the enzymes. In this slide, you see that there is a type of binding, the allosteric bindings. Actually, in what happens in the allosteric bindings, the drug or the agonist is not sitting on the agonist side. It is actually binding to the effector or the enzyme molecules other than the active site. That's why we see that the allosteric bindings occurring, and actually it can enhance or inhibit the receptors, means if it is agonist, it can increase the activity of the enzymes or the receptors or other regulatory proteins, or if it is an antagonist, it can decrease the activity of the receptors or the enzymes as well. And because the binding of the allosteric drugs is other than the agonist side, increasing concentration of the drug cannot overcome the agonist dose. That's why it is no use increasing the agonist if we have the allosteric antagonist. And in this example, we see that when we use the neostigmine or the rivastigmine, that are the acetylcholine inhibitors, they actually act as the cholinomimetic, and means they bind to the cholinereceptors, and they actually increase the concentration of acetylcholine as the synaptic cleft or the postsynaptic neurons. Means we are actually using the inhibitors of the enzyme that is decreasing the endogenous acetylcholine. That's why when we inhibit this enzyme, the acetylcholine concentration is increased. This is the most common example in the pharmacology. While we take the example of the antagonist inhibiting. And in this diagram, you see that different types of the receptor bindings, like what are the agonists, you see that they're bound to the active site, and you see the competitive inhibitor that is inhibiting the in the active site, and the allosteric activator that is acting as agonist but is sitting in another place other than the active site, and the allosteric inhibitor that is inhibiting the activity of the enzymes or other regulatory proteins other than the active site. So in this curve, you see that A plus C means the agonist and the allosteric activator is these two are sitting together and they are increasing the response. Look, the response is more in when there is agonist and the allosteric activator. And then you see the agonist alone means it will not usually get the full response as the agonist and the allosteric activator. And then we see that in the agonist and competitive inhibition, there is less and late response. Look, there is actually the late response. There is the first response and the earlier response. But in the agonist plus allosteric inhibitor means when we increasing the agonist, there will be no use because the inhibition is acting other than the active site. In this diagram, you see the dose response curve. When you see there is full agonist, means the drug acts with the receptor as a full agonist, and we get the full response. In the partial agonist, we cannot get the full response, and in the antagonist means when there is antagonist or the drug sitting on the receptor side, there will be no action. And you see that what is inverse agonist? Actually, this increase the activity of the antagonist to the physiological receptors. That is the inverse agonist. And in the constitutive activity, we don't have any agonist that sits on the ligands. Actually, we need the second messengers like the G proteins when we want to study the constitutive activity of the drugs. In this slide, you see the different example like the partial agonists. Actually, it will not be causing full action as it does in the full agonist. Means we will not getting the full response of the agonist. We in the example of the pendolol, we see that it will not uh, having or achieving the full action or the full response. And when there is epinephrine present as a stimulant, means it will be increasing the activity of the beta receptors. Then we see the pendolol will be acting as a full. And in the neutral antagonist, we see that the drug will be just sitting to the receptor site, and it will not actually inhibit the activity of the receptors. In the example of the naloxone, we see that it will be binding to the opioid receptors, but it will not be inhibiting the opioid receptors. And inverse agonist means when we want to increase the activity of the physiological antagonist, like we see the GABAergic receptors, means the receptors actually are the GABA receptors actually are the inhibiting receptors. That's why when we use the benzodiazepines, means this drug will be increasing the GABAergic activity. Means there is more in the neurotransmitter inhibitions in that case. Actually, this is the inverse agonist. I have finished this lecture. Hope to see you in my next videos. Good luck.